Welcome back. You're still tuned in to News and Views with myself, Salailo Makwidiri. The time is 10 minutes before the top of the hour, 9 Central African time. And yeah, we're going to be switching gears to a rather concerning turn of events. When most people hear children dying of hunger, their minds go to images of war-torn Gaza or famines in Somalia or South Sudan. But this morning, excuse me, we need to bring our attention a bit closer to home, our own country, here in South Africa, where children are quietly succumbing to malnutrition within our borders. In Gauteng alone, there's been over 160 children that have died since last year from preventable malnutrition. And in the first 3 months of 2025, this year, there's been 38 children under 5 who also unfortunately lost their lives. And while interventions are seemingly lagging, young children, future of this country, they're dying. And I think it's a very, very concerning turn of events, and that needs to be given as much attention as possible. And we're going to be doing just that. We'll now be joined by Matshidiso Lencoasa, who will help us understand how deep this tragedy runs and what we must do. She's a budget policy analyst and researcher at Section 27. They're looking to raise alarm, to conscientize South Africa, and I think most importantly, those that are in government about this tragedy that could be preventable, especially in a country like ours with the resources that we have. But Matshidiso is joining us via our virtual platform. Matshidiso, good morning. Thank you so much for joining us. Really appreciate you giving us your time.
Good morning. Thank you so much for the opportunity to talk on this really important topic.
Most definitely. And I think let's jump right into it. If you can just give us insight on just how widespread malnutrition is here in South Africa, especially child malnutrition, and what are some of the hotspots, provinces, is it mainly in rural or urban areas? I think it would be very, very interesting to unpack that aspect.
Yeah, I think to start off with, to just paint a picture of the landscape that we're in. So I think what you had said to frame this discussion around, when we think of South Africa, we don't necessarily think about malnutrition and children dying of hunger. So this, and largely because there have been policy interventions since '94, especially, that have been targeted towards fulfilling the constitutional right to the right to basic nutrition for all. So we've had programs like the school nutrition program, and we've had the child support grant, for instance. We've also had food parcels in the Department of Social Development, just many interventions or early childhood development to ensure that children are able to eat. And one of the most powerful ways is through the school nutrition program, because many learners rely exclusively on the school nutrition program to eat, it's for their only meal. And so for a while, I think this is something that we had taken for granted as a country. But recently, there have been reports, so dating back to 2022, when the South African Human Rights Commissioner sounded the alarm on rising malnutrition in the Eastern Cape. And since then, I think a month ago, the commissioner has actually summoned the premier in the Eastern Cape to account, and other governments, departments, to account for rising malnutrition. So really what we have is a country that's food secure. We're a net exporter of food. So we have so much food that we share it with the rest of the world. And yet somehow within our borders, there seems to be a rising crisis where children especially are succumbing, especially children under the age of 5 who are not captured by the school nutrition program, are succumbing to preventable malnutrition.
I think very, very important to note that, because I'm just thinking to myself of, those deaths, how many are captured in official stats and how many go unrecorded because, maybe children never reach clinics or hospitals. But I want to jump into some of the key drivers. What are the main drivers of child malnutrition here in South Africa? Because you mentioned some of those mitigating factors that have been put in place. Is it rising poverty, food access, or health systems, or social grants that are not reaching those children, or is it something totally different, something a bit more structural?
Yeah, I think you're on the money there, around rising hunger, rising poverty, especially in a country where, we're described as having a triple challenge of inequality, poverty, and unemployment. And, since then, we haven't really done enough to address that. We see that with rising poverty levels in the country. We see that with persistent unemployment, especially youth unemployment. And we also see that with some of the highest rates of inequality in the world. So we have this problem, and it almost feels like a ticking time bomb with an economy that seems to be really well functioning on paper. So we have a lot of money as a country, especially a province like Gauteng, one of the richest parts of the continent, so much money here. And yet we're now starting to see this, people succumbing to malnutrition. What we see it as is not a crisis of a lack of food or of a crisis of food supply, but rather a crisis of governance and a crisis of redistribution or failure to redistribute what we have. So we have excess food. I think there's even food wastage issues in Gauteng that political parties have sounded the alarm on. But at the same time, we also have people who are dying of hunger. So we see it as a problem with how we, redistributive policy. Are we ensuring, as a government, the governments of our country, are we equipping programs like the child nutrition, school nutrition program, child support grants, early childhood development, like those programs that ensure that there's food on the table every night for the most marginalized people? Are we actually equipping those programs to address this rising poverty? And more importantly, are we building, our economic policies in our country, how we tax South Africans and how we spend the money of our taxes? Are we ensuring that every single rand goes towards developing a country that works for everyone? Or is it that or those riches concentrated to a small proportion of our country? And that's what we diagnose as a problem in our country.
I think it's very interesting that you're touching on government, because that's where my next question is going to be leaning. The response from government, how are they responding to this? Well, what have they been saying? Or, has it just been business as usual? Children dying, losing their lives. These are, poor children in some village in the Eastern Cape that no one sees or seemingly even cares about. Has the response been adequate from the government institutions that should be doing everything that you mentioned?
Yeah, so I think if you look at the South African Human Rights Commissioner having to summon the government departments for failure to address the problem or take it seriously, that would indicate that we're not doing enough. Our government is not doing nearly enough to address this issue. I think also with the government departments who have been spoken to about I think the criticism that we have as the Budget Justice Coalition, as civil society, is that it seems as though our economic policy, government is of the view that our budget, for instance, our economic policies, our monetary policy, industrial policy, etc., are victim to the poverty, the inequality, the unemployment, the hunger in our country. But our view is actually it should be the other way around, that our policies, our budget needs to be best positioning our government to respond and to proactively address some of these issues, and the most, low-hanging fruit is equip the programs that are already working. The school nutrition program is feeding learners, is reducing malnutrition, because you can see the numbers. The rate of malnutrition seems to be happening to the learners who are not captured by a formal school nutrition program. Yes, there's an ECD subsidy that should be helping with that, but it's so insufficient and has been underfunded to the extent that many it doesn't really capture a lot of learners. Plus the lay of the land with the ECDs is so many that are informal, and it's just very difficult and not so coordinated. So it is very clear that there are interventions that are there, or existing policy mechanisms and instruments. All we need is the political will to ensure that those are realized before it's too late.
No, most definitely, Matshidiso. Unfortunately, we have run out of time. Thank you so much for joining us. Really, really appreciate it.
Thank you.
There you go. There was Matshidiso Lencoasa, bringing, I think, a very harsh reality into focus. Who would have thought? Young children, essentially, even young people, children here in South Africa, within our borders, dying of malnutrition, hunger. In a country like ours, where There's so much food wastage. There's so much access to food, but we still find ourselves in a place where children under 5 years old are not getting enough to eat to a point where they die. I don't think we're angry enough, man. I mean, we should be angry should one child in South Africa die because they don't have enough to eat. There should be so much uproar. But the numbers are going into the hundreds, and no one is talking about it. These are not distant tragedies anymore that, you see on TV or, on your social media, Somalia or Gaza or, whatever. This is here in South Africa. These are homegrown deaths that could have been prevented. Wow. Going to take a quick break. When we come back, News and Views continues.